another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today we're speaking on microbiome health and breastfeeding with a very special guest, Dr. Eden Fromberg. Dr. Fromberg is an integrative obstetrician, gynecologist, holistic women's health specialist, and osteopathic clinical professor whose innovative and engaging approach to reframing the medical dialogue and implementing effective health and wellness strategies with her patients and clients is unique and unsurpassed. Her practice is in New York City and the Hudson Valley and is a sanctuary for truly holistic women's health care. Dr. Fromberg is also the founding director of Lila Yoga, Dharma Wellness, where she teaches and curates programs and trainings for women. Dr. Fromberg's extensive and diverse background, years of clinical experience, dedication to caring well for her patients, and active interest in current research and innovation give her the opportunity to sort out complex issues and offer a range and depth of options to meet her patients' needs. In addition to her expertise in integrative fertility, pregnancy, and birth, Dr. Fromberg applies a functional, structural, and biointelligent approach to addressing all areas of gynecology and women's health and beyond. She creates unique, customized programs designed to encourage the body's innate abilities and healing processes to flourish, addressing underlying causes and prevention in addition to symptoms. Nutrition, movement, meaningful information, cutting-edge research, alternative perspectives, and a range of potential options offer Dr. Fromberg's patients the care, relief, and support they need, while often avoiding the potential side effects and risk of pharmaceutical medications, synthetic hormones, and surgery. Dr. Fromberg takes a special interest in the complex areas of female pain, pelvic floor, and sexual dysfunction from an integrative perspective. She helps women throughout the life cycle achieve optimal hormone health and is a bioidentical hormone expert. In addition to her busy medical practice and wellness studio, Dr. Fromberg teaches and consults locally and internationally. She's worked collaboratively with midwives and birth centers in the Hudson Valley, Bali, and New York City, supporting culturally sensitive, gentle childbirth practices worldwide. She's appeared in the film The Business of Being Born and in the Pregnancy Health Guru series on fetal development. She's been a consultant for Birth India and has worked intimately with midwife Robin Lim, 2011 CNN Hero of the Year, and the Bumi Sehat Gentle Childbirth Foundation in Bali, Indonesia since 1997. Dr. Fromberg has been on the Medical Review Board and writes for the Huffington Post. Her work has been featured in Time, Yoga Journal, Bust, Natural Health, Parents, Spirituality and Health, and Midwifery Today. For more information, please visit her website at dredenfromberg.com. So welcome, Dr. Eden Fromberg, to another episode of Well-Adjusted Mama. I'm so happy to have you on the show again.
And I'm so happy to be here with you.
So today's topic is going to be on the microbiome and breastfeeding. And I know this is a topic that you're very passionate about. And I would love for you to share with the audience about recently who you spoke before and what you spoke about regarding this topic.
Yeah, so it was just a couple of days ago, the World Congress, the 23rd World Congress for the ISSCD, which stands for International Society for the Study of Vulvovaginal Diseases. They were in New York, here at New York University, and I was able to speak at a roundtable discussion that they had, various speakers. And my talk was about the vaginal microbiome and how some of the research being done on the microbiome in other areas, such as the fecal microbiome, could really, help us understand the vaginal microbiome better and create new areas of research and even treatment approaches.
Mm-hmm. Wow, that's so cool. What an honor.
Yeah, I was very honored to be there, and it was a really great international group. I mean, people from Australia and all over the world.
Mm-hmm. So this is really cutting-edge research and science that's coming out, and it's exciting because I think there's a lot that we're realizing that we don't know, and so there's an opportunity to do the research to get more information.
Yeah, and I think, I can talk a little bit more because I think a lot of what came up in discussion with this group is relevant to what we're going to be talking about anyway. But so I'll just present what some of the research is showing generally about the vaginal microbiome because it turns out that some of the older culture-based techniques, I mean, people are used to vaginal cultures, they actually missed a lot of the vaginal microbiome. There were a lot of organisms that were sort of like grouped together and they weren't really teased out. And now with these new molecular-based techniques, they can really get down to the DNA level, which is extremely important anyway and fascinating, and see that there are many more strains than we ever thought. And what's interesting is that there are a few strains of lactobacillus that, you know, people haven't even heard of, like Lactobacillus iners, I-N-E-R-S, is the most common one in the vagina. And so when people take probiotics, you definitely never see Lactobacillus iners in there. And there's another one called Lactobacillus crispatus that seems to diminish in levels when someone has BV, and you certainly never see that one. And what's also interesting is that when studies have been done, when, for example, they try to give a woman the Lactobacillus crispatus, the one that's the good one, it doesn't really work to just sort of go in there and bring the microbiome back to a state of normalcy, and it's not that simple. And so what we're realizing is that it's really an ecosystem that depends on what we call host factors, because we as humans are the hosts of our own microbiomes. You know, who are those little guys, these little microorganisms, hopefully the probiotic ones, but they're not all friendly. So these little organisms, they live throughout our bodies. They live in our guts. They live in our sinuses. They live in our vaginas or penises, as the case may be. There's a skin microbiome. So all these different areas, they also interact. So it's like any landscape or ecosystem. It's like, you know, you go down towards the river. It's a little bit different than when you go up on the mountain, and the area that gets more sun maybe is a little different than the other areas. So our bodies are very much like ecosystems. And so if you just isolate out one flora component, like the Lactobacillus crispatus, and you're like, wow, this woman has BV, or she has this polymicrobial bacterial shift going on. Let's give the crispatus because it seems that that will normalize things, and then it doesn't work, and you're like scratching your head. It's because how does the other organisms in there accept the Lactobacillus crispatus back in the community? I often liken it to like a schoolyard of unruly children running around down there. It's like you can't just introduce a couple of new kids in the class and think it's all going to necessarily work out, right? Those kids might get beat up. They might not be accepted by the other children. So, you know, maybe if they have a sandwich to share or a cool toy, and this is where the DNA gets important. This is exactly what's happening in the microbiome, is that when there are new organisms that come in, they're sort of like this checking each other out phase where DNA literally will be shared. And, you know, some of the colonies will survive better than others, and they may or may not be a shift in flora. And I think last but not least on this point is just, you know, the idea of antibiotic use, which is so prevalent in our culture. It really kills off, you know, a good portion of the microbiome. And then, you know, it's like, well, let's see who grows back. And, you know, you might get lucky, you might not. I mean, some studies are showing it can take up to 4 years to try to rebuild a microbiome after a single course of antibiotics. And most people certainly take antibiotics more often than every 4 years, which is a problem. And I guess another aspect of that is the antibiotic use in agriculture and our food supply. So when you start to look at it at that level, then you say, oh, it's not just our body's ecosystems, it's really, you know, the agricultural and food supply and really the whole planet.
Wow. I mean, and that's so true. I was just at a detox summit, and they were reminding me that the largest source of antibiotic use is farmers feeding, you know, antibiotics to the livestock that are butchered, and then people eat that meat. So I think a lot of times people don't even have an awareness of how much exposure to antibiotics they're getting through the meat, if it's non-organic meat, or even potentially through the water supply, because antibiotics can end up in there as well. And that's scary.
It's a huge problem, and I think it's really underappreciated, because when a patient comes to me for lab tests, I wouldn't really be able to easily order lab tests that test for trace quantities of antibiotics and other chemicals. And if a patient of mine has a yeast infection, it's a really interesting question that I have. Could antibiotics in the environment or the water supply go so far as to cause, you know, actual clinical changes in our patients? I mean, certainly with the pesticides and the BPA and all these plasticizing chemicals that are clearly endocrine disruptors, we know that it's true. You know, hormone changes, pain, cancer. Not that we're really cleaning up the environment, but the microbiome is another huge aspect of the environment that it's almost frightening to see how bad it's getting, really, because they have a lot of drug-resistant organisms, which means that if you do need antibiotics, they might not work.
Right. Yeah, that is scary. So let's shift gears and just talk about, if you could just please explain, what is the microbiome for people who've never heard that concept?
Yeah. Well, the microbiome are the microorganisms that live in a commensal, let's say, relationship with our bodies. It's sort of like, people may be familiar with the concept of parasites, where it's the idea that the parasite is taking something from the host. Parasite is more something that will diminish the host. So, taking energy, taking food, taking something. But some of these organisms are actually quite beneficial. And so I think with evolution, these organisms evolved along with us and along with the environments that we lived in. And so people living in different parts of the world will have different microorganisms living in their bodies. But like I said earlier, they live in different areas. So there's a microbiome associated with the skin. And, of course, it would be different, let's say, under the armpit than on the back of your hand, let's say. The microbiome in the vagina or penis, the microbiome in the sinuses. Those are some of the big areas. And then when it comes to pregnancy and birth, the baby has, or the fetus has separate microbiome, and there's a placenta microbiome. And there used to be actually a false impression that the placenta microbiome, I don't think they even knew it existed. It was considered a sterile environment in there. And, of course, in more recent years, we've started to understand that a bacterial vaginosis infection in pregnancy can lead to miscarriage, fetal loss, premature labor, things like that. Various organisms like group B strep can lead to neonatal sepsis even. Some of these can be really serious. So the microbiome, newer research, especially over the last few years, is really showing the great, great importance of it, because the microbiome, it doesn't just exist and interact. It also seems to set us up for a lifetime of well-being or illness or, what chronic diseases we may even get later in life. And so the microbiome is set up from even before birth, apparently, and then, of course, during birth. It's a big, big setup there. During breastfeeding and early infant feeding, the setup of the microbiome continues. And so the early formative microbiome exposures and experiences are actually extremely important for setting up any individual for their entire lives. And so studies showing that maternal stress can alter the vaginal microbiome also show that it alters the microbiome of the fetus, even if the fetus is delivered by a sterile cesarean section and never exposed to the mother's microbiome. So things like stress, something as subtle and hard to quantify, stress, can change these parameters. But certainly an antibiotic is going to change things, and possibly even drastically. A vaccine could very well change these things. Genetically modified organisms, the evidence is showing that if you eat a genetically modified organism, the truth is that the DNA from the genetically modified organism may swap with your microbiome, and that it may incorporate the little pesticide factory that was only meant to be in the corn plant into your microbiome. And then all of a sudden, your microbiome is producing a pesticide. And this is a big issue now. It's like maybe we should be looking more at the microbiome than almost any other area, because whether you get cancer or whether you get asthma, whether you have childhood ear infections or you get diabetes, all this may be very much set up by the microbiome. It's a pretty powerful area, and only just becoming really seriously taken into consideration and explored clinically.
Wow. You just gave us so much content there, and it's really, I think this is so important for women to hear about. We have women that listen to this podcast that live all over the world, and unfortunately GMOs have certainly traveled outside of the United States as well. I think Europe has banned it, so that's awesome that they're not having that exposure, but we really are just getting exposed to so many chemicals, like you mentioned, that impact hormone balance. And we don't, and even having hormone balance, I know that birth control pill, for example, can impact candida overgrowth. So having hormone imbalance from plastics, for example, could also certainly contribute to overgrowth of candida and bad bacteria, like you were mentioning, and throw off our microbiome.
Right. And what you said before about Europe banning GMOs, it's true. And right now, I hear that the United States is suing Europe to try to force Europe to accept the GMO import from a trade perspective. So I guess the battle isn't over yet, is all that I'm saying. The overuse of antibiotics is a big problem because, many times if people feel like they may have a respiratory infection or even a vaginitis, antibiotics are given out fairly liberally still by doctors, even in cases where they may not even be helpful. Like most pneumonia is viral, not bacterial, but, who would want to take the risk of not treating with an antibiotic? What if, there is a bacterial complication? So there's a lot of sense also that patients want the antibiotics, and so that the prescriptions are more easily given out. But when it comes to pregnancy, I think this is where we really have to look at it, because that's where you set up the early microbiome. And so what are the instances of the use of antibiotics in pregnancy? Well, obviously, things like taking antibiotics to clear up your skin, not a good idea. Taking an antibiotic for a more cosmetic or soft reason is really not a good idea. So antibiotics really, I think, not even just in pregnancy, but in anybody, should really only be reserved for a time of true need where you have an infection that is really not going to clear up any other way. And unfortunately, we live in a society where people are expected to show up at their jobs even when they're sick and be on antibiotics, which is not a good situation. You really need to use treatments like rest and fluids and staying in bed for a day or two instead of trying to, muster through with the antibiotics. But the problem with pregnancy and antibiotics is that it changes the microbiome, and the microbiome is associated with, among other things, the brain, and brain development is extremely crucial during fetal development and early childhood. So, you want to set up the brain the best way you can. And so there are a lot of nutrients that need to go in. We know a lot about that. But when a woman takes an antibiotic and changes the microbiome, it's going to change the way that the brain perceives, for example, autism. If you change the diets of an autistic child, there are various diets out there, and I'm not going to get into that as a whole topic, but a diet change can make a huge difference in the way that a child functions behaviorally. Autism, other learning issues, various psychiatric conditions of adults as well are very diet responsive. I mean, sometimes it's something simple, like you say, oh yeah, gluten, but sugar. Sugar is huge. And is sugar just raising the blood sugar or raising the brain glucose level? It's much more complex than that. What sugar is doing is it's feeding the microbiome a lot of high-intensity carbohydrates. So which organisms live in the microbiome may be quite different in a higher carb diet. And so ketogenic diets that are more nerve and, brain enhancing are very important, but also as a way of feeding the microbiome differently, because candida, not only does it come from antibiotic use, but it can come from a more high carb or high sugar diet. And so diet, antibiotics, all of these things during pregnancy really can set up fetal brain development in a lot of important ways. Even more so in boys. Boys, it seems like the brain tissue is even more vulnerable. So I think that, I've said a lot about that. I'm not really sure what else.
Yeah, I mean, you just once again gave such great information. And to your point, boys do seem to have more of a sensitivity in utero and their first couple years of life regarding their nervous system, because we do see that they have higher rates of autism. Now, 1 in 68 children are diagnosed with autism in the United States. And, I was reading a paper that said the CDC is predicting 50% by 2025 diagnosis of autism, which is so scary. That's 1 in 2 children.
Wait, so we're talking 1 in 2 children? Because my understanding is 1 in 6 children has some sort of a neurodevelopmental delay at this point. So 1 in 6 seems bad enough. So you're saying 1 out of every 2 children?
Yes, in 10 years, 2025. Yeah.
So I'm not sure why this isn't being experienced by our entire culture as an extreme public health crisis, because that's how I
agree.
look at it. And I didn't realize the statistic had been accelerated that much.
Yeah, it's so scary, and there's so many different factors involved here, but it is certainly epigenetics is, to play here. It's the chemicals in our environment, it's our diet with the GMOs and sugar, and it's over antibiotic use. All of these things that we're talking about are contributing, vaccines are all contributing to this acceleration of, children that are having chronic illness and brain damage essentially, and this is a public health crisis. I agree.
Yeah. I think that, so here we are. We're going to sound the alarm bells big time here, but it really is. And I mean, people are not being served, and I'm just going to get a little bit upset about it now, because the way I talk to my patients day in and day out about this, there's this onus on us as the individual to sort this information out and do our best in light of it. Our governments are not helping us. They are not creating the regulatory guidelines that would stand up to these industries that stand to profit from this. And the healthcare system is one of them as well, so don't think that standard guidelines are necessarily the whole story. I mean, there's a lot of controversy in healthcare, and just, not to get too far off of our topic, but to say that both the former editors of the New England Journal of Medicine and the Lancet have come out saying that a lot of what's called science is very much skewed based on who's funding the science and, various suppression of reports that could be helpful. So I think it is important to just be aware and also to get a little bit upset about it, because it's frustrating for me as a clinician, as a doctor, to try to help my patients and have the patients say, but where I work, there isn't any good food to eat in the neighborhood. And, it's just the practicalities of how people can incorporate these recommendations, even the best recommendations that we've come up with into their lives, is really difficult. I mean, just the availability and the way that the culture is set up just makes it very challenging.
And you know what, I wanted to clarify what I just stated with that study. I looked it up. It was a senior research scientist from MIT, Stephanie Seenoff, who said half of all children will be autistic by 2025. So not even on the spectrum or on having other chronic illness, but specifically that, based on all of these, exposures chemically. So that study can be found at anh-usa.org, the Alliance for Natural Health. And
what's interesting also about that is that the diabetes statistics, I believe, are saying that within, I think, they used to say 2050, but now they're saying 2030, half of all Americans will be diabetic. And, I mean, can this not blow our minds? This is just unbelievable.
It is. So I think, moms, of course we want the government to protect us and do the due diligence, but unfortunately that is not happening right now. So that's
in the meantime,
in the meantime, moms, do your research, be educated consumers, and, we can certainly make a difference in our own families and our communities. So getting back to our topic, can you speak a little bit about how the different types of birth, vaginal versus cesarean, can impact a baby's microbiome, and if the baby is born via emergency C-section, what a mom can do to help with the microbiome?
Yes. So this is obviously a very important area, and what we're aware of now is that a vaginal birth sets the baby up. By being born vaginally, the baby's exposed to the mother's vaginal microbiome. It's essentially, being squeezed right through it. So the flora are in the eyes, the nose, the respiratory tract, the mouth. I mean, really, the skin. So the baby is exposed to all of those flora at the time of birth, or the vaginal birth. And what's been discovered with some of the more recent research is that the babies who are born by cesarean seem to have a higher incidence of atopic, like allergic reaction type, and autoimmune diseases. So anything ranging from asthma to, the various autoimmune diseases like lupus, may be higher in children born by cesarean. So the reason for that that's been figured out is really it's that microbiome exposure that is really very important for setting that infant up. And so some of the research that's being done now, there's a good film out called Microbirth that talks about some of this research. But Maria Gloria Dominguez-Bello at the VA in New York, her research involves taking a piece of gauze and folding it up kind of accordion style and putting it in the mother's vagina before a cesarean section. So obviously this wouldn't apply in the case of an emergency C-section, but maybe you could, emergently, put the piece of gauze in and get what you can get. But the idea is that the gauze would be inserted into the vagina and then removed before antibiotics would be given. So that's very important because once antibiotics are given, it's altered the vaginal microbiome, but it still may be better than no microbiome exposure. Right. So what they did in this study is they would remove the gauze, and after the baby was born by cesarean, at a very early stage, during the pediatric resuscitation, they would expose the baby, the mouth, the nose. They would wipe the gauze around the face, various parts of the body. And what they were finding, and the research is ongoing, is that this is seeming to diminish some of the incidence of these illnesses. And of course, it's not a long-term enough study to really see, but it does seem to be the way to go. And so if a woman's having an emergency C-section, she could certainly, see if she can get some vaginal flora out to expose the baby to. And if they're using an antibiotic during the cesarean, I would still do it. There's still flora. It's just not going to be quite as robust, but it's still going to be flora. And then beyond that, of course, touching the baby, skin-to-skin contact is a great setup. There's a lot of discussion of attachment, bonding, and oxytocin, which is all very true. But in terms of the microbiome, the skin microbiome, the mom touching the baby, other family members, maybe not everybody visiting the baby too early on because all their microbiomes will come in too. But breastfeeding is the next thing where the baby is exposed to the breast microbiome, and there's a microbiome in the breast milk and nutritious factors in the breast milk that nourish the human microbiome. There's even microbes in the armpit, which you might think of as gross, but actually they're beneficial microbes in the armpit. So I would advise a woman after she has a baby and is breastfeeding to really not use certain deodorants, or maybe see if you can go without for a while. But the deodorants that I prefer are more based on like the alum-based deodorant, Stone, let's say, or Kiss My Face has one called Liquid Rock. That's pretty simple. And, to just really keep it simple, low on the chemicals, really, let the baby be exposed a lot.
So avoiding the antiperspirants that have aluminum that are going to kill the bacteria and, impact the microbiome exposure for the infant.
Exactly. But, just any substance used in the armpit is very, very close to the breast tissue. And, it becomes an issue, of course, with lymphatic drainage and cancer from the breast as well. But since, we're talking more about the microbiome, in that regard, some of the bacteria may cause an odor, but that's why some kind of the natural deodorant, Stone, it has a more natural bacteriostatic effect as opposed to doing it through like a chemical, which, you doing it through a chemical is more like an antibiotic approach, let's say.
Mm-hmm. Yeah, that makes so much sense. Wow. And so, this is good to know. Now, what about if a mother had a vaginal delivery, but she was positive for group B strep and was on antibiotics during the delivery? How's that could impact the baby's microbiome?
Yeah, I think it's definitely an issue, and I think that it really calls for us to start looking at the Group B strep guidelines and reconsidering possibly because of this impact of antibiotic use. So what can the mother do? If she already knows she has Group B strep, I guess she could put a gauze in the vagina and then feed the baby afterwards. But that's sort of missing the point of why they give the antibiotics if you think about it. Because the idea would be they're giving the antibiotic to alter the mother's vaginal microbiome for a reason, the Group B strep, with the idea that the Group B strep would cause an infection that would be harmful or possibly even cause the baby to die. That's very serious. So, to advise a woman to take the group B strep infected vaginal flora and then feed the baby after birth, I don't know that I could really advise that in good conscience, because the point of giving the antibiotic is to get rid of that type of flora. So I think that is a complex situation, and that I've really thought about that in recent years, that we really do need to look at these guidelines and possibly change them, because there have been different group B strep guidelines over the years. Some have been based on the situation at hand versus just a positive culture, meaning, let's say the woman's water, broke 2 hours before the baby was born. Group B strep may not really be an issue unless the water's broken for a longer period of time, 18 hours, 24 hours. I mean, I've seen different protocols in the past that have been used, so it's an evolving issue, and I do hope that it evolves to where the women who really don't need antibiotics don't take them. And I think we're getting into an era where medicine really has to be individualized and personalized in this regard, because a lot of the past protocols, like vaccinate everybody, do C-sections on every baby whose heartbeat drops for the breath of a second, you can't really apply these broad interventions to people without a lot of consequence. And I think that's what we're seeing in the modern world. It's like, wow, antibiotics were so great in the 1940s and 50s, but look, we're sort of actually paying for it now. And people get even defensive, all these autoimmune diseases, they're really a problem, but it's hard for us to change the underlying way that we, do medicine, live our lives, even though it might make a huge impact. I think we really have to start looking at that.
Yeah, for sure. And, I have a home birth midwife in my practice, and I have seen some of her clients that were tested, during their third trimester positive with group B strep, and were able to do a natural protocol to actually change the flora, the vaginal flora, so that they could avoid antibiotic use during the labor.
Yeah, and see, this is the thing. There is no official protocol or guideline on that, but what I would say is, so what can people do to try and alter their microbiome? Like, for me, group B strep, it's often being tested so close to the time that a woman's going into labor that she might not have time to then do something about it. But this calls for yet another thought. So maybe go outside the guideline of culturing at 36 weeks. Maybe if you cultured a month or two earlier and you detected group B strep, you could do certain interventions like taking probiotics, eating yogurt, eating fermented foods like sauerkraut or kefir or kimchi or something like that, as a way to try to change things. And then you'd have an opportunity to test again. So I think that is a really good approach, but I just found that with the current guidelines, they happen too close to the time of actual birth to really assess whether what you did worked. And I know, there's a midwife that I've spoken to who has used Cleocin vaginal cream as just as an alternative to the intravenous antibiotics. But I see Cleocin as just another antibiotic intervention. I don't know. I think, it helps you not have a needle in your arm, but it doesn't actually avoid the antibiotic being given. Right.
And so, I think that also what we're speaking on, like, once again, if the woman has time and notice to shift, her as the host is actually making, lifestyle changes that are going to actually create a different flora, a more positive, healthy flora for the birth. So you just mentioned a few options there. Anything like, the fermented foods, taking probiotics. I love Claire Labs. They have a woman's formula. Those strains are specific for, a woman's, genitourinary system. What about anything topical that a woman could do, like, inserting a probiotic or anything that she could do during pregnancy that could help?
I actually think that it would be really cool if we had more probiotic inserts that people could explore. And I've actually talked to people about doing studies about such things, and they always tell me, but if we do a study, we really only have to isolate one variable. And I'm like, but it's like an ecosystem down there. Can't we just see if people feel better? Because that's really the variable that most people care about at the end of the day. So what happens is I have patients use probiotics vaginally sometimes. There are some that can be obtained from foreign countries that are made for vaginal use. In the States, I don't really think that the FDA allows any to be labeled specifically for vaginal use, although I'm aware that people use certain ones for vaginal use. And I think, if somebody was going to do that, it would be important to make sure that none of the inactive ingredients or the ingredients in that formula were going to be incompatible with vaginal use. I mean, a lot of people say don't put in your vagina what you wouldn't put in your mouth, which I think there are definitely exceptions to that. We don't have to overthink that right now. But yeah, it's different. It really is not exactly the same, and you're not feeding the same microbiome. So, possibly, the formula that you like. I really individualize for people, and I think about, what's going on with them, and to the extent that I can with the testing. And then I'm aware of a lot of different probiotics, and I try to individualize because some people, for example, may have, let's say, a Klebsiella in the fecal microbiome, and that might make, let's say, certain prebiotics less preferable, or somebody may have a higher immunogenic or allergic response, and so I might try to avoid the Bulgaricuses or certain dairy-based probiotics that might have more potential for histamine production, for example. But, the old-fashioned method of just, throw some probiotics down there and hope for the best may not be so bad. I mean, there was just a study on infant eczema that showed that taking probiotics during pregnancy seemed to diminish the incidence of infant eczema, but, of course, not for everybody. But, if you look at a broad statistic, it does seem to help. It's just a matter of how do you make it specific? I mean, we're all sort of snowflakes on microbiomes, really.
Right. And then, I've seen that in my office with infants with eczema because we know that skin issues are coming from the gut, so impacting that child's gut microbiome through the use of probiotics can certainly be one part of that picture. The other thing I find helpful is removing any allergenic foods, from that child's diet. For example, if they're on a formula and they're sensitive to milk, then that could be creating the inflammation and causing the eczema. So there's so many different factors there, but all of it does relate to the microbiome. And if that child was also born via C-section, then we know that unfortunately, their microbiome's already a little bit, compromised, and that's going to potentially make them more sensitive to more types of foods and have more food allergies and asthma as they get older.
Right. It's, the microbiome is so important, and there are so many things that I guess converge in early development to really set us up for life that it's good to be aware of so many of them and really try to optimize as many as possible because we're not going to ever get it right 100% of the time. I mean, life is just not perfect that way, but it really behooves us to do it in as many areas as possible because it does seem to make such a difference. I mean, stress, what we were talking about earlier, and this is where it gets hard because, again, it's hard to quantify, but stress comes in various forms, physical, mental, psychological, emotional. Just being cold can make you stressed. Just being hot can make you stressed. Walking down the street can make you stressed. So how people, I don't know. I guess one way I would put it is how people run energy through their bodies. What's the demeanor of their day? Are they often feeling overwhelmed and like they're running around? Or, are they feeling more relaxed? Or do they have a lot of pressure in their life? I mean, these things do play into it. And, so to the extent that anybody can control or at least participate actively in these areas, mind-body practices, breathing is a really good big one, I think, for anyone because breathing not only brings oxygen into the body but really trains the nervous system in ways that can change things through sort of neuroimmunological connections. I mean, even social issues can change the microbiome. If your boss is mean to you, it could change your microbiome. It's like there's so much subtlety and nuance to this.
Wow. And what you're saying, there's so much that we still don't even really know. We need a lot more research to be able to understand. I was part of a study where I swabbed different parts of my body to get my microbiome tested, which was pretty cool, except they're still not able to give me any information of what to do with that data. So they're able to tell me which bacteria, are thriving and how that relates to other people who've been part of that study. But there's still more, like, customized probiotics are probably the wave of the future, where you're able to swab and they're like, okay, you're deficient in these areas, maybe, we can bump it up and through a customized probiotic, but that doesn't exist yet. So I think it's exciting that there's so much more to learn and how we can individually, to your point, treat a patient, whether it's the mother or the baby, through, a supplement, for example, a probiotic.
Right. But again, a customized probiotic, it may really fall short because the host factors, so to speak, like the environment that you're putting those probiotics into, it may not be the best environment for them to survive in. And so I think what I'm saying is if we want who we think are the good microbes in our bodies have to be a supportive place for that. It's almost like, if you make a very scary haunted house and you call it a playground, I don't know if the kids are going to really go in there. It
right.
really has to be a supportive environment, and I think that's the area that it's hard even for my patients to focus on. It's like I will do a stool test on somebody who takes 5 times a day Lactobacillus acidophilus, and it will have no growth on their stool test because it's being thrown down in there, but it's not being incorporated into the community. And so I think that's the area where we really have to look at it. Like, A, don't destroy the community in the first place. And then, B, how can you restore it if it is compromised? And it's not as simple as probiotics, and that's what's so frustrating, I think, because we wish it was.
Yeah. So that's such a good point. This is really overall lifestyle. It's how you manage your stress. It's what you eat. It's how you move your body. It's really it's holistic, right? And because the microbiome is all over our body. And also the latest research shows that we have 10 to 1 bacteria versus human cells, right? So this is also, we're more bacteria than we are human, which is so funny to think about. And so there's so many variables, but if we can just, make the best, healthiest lifestyle choices for ourselves and for our families, we're going to see improvement in that microbiome.
I agree. And so, if you think microbiome, probiotics, but if you think microbiome, you should be thinking stress and diet and everything else, and even what you said, movement. I think movement is the highly underappreciated area in medicine right now. It's alluded to, but there are all these mechanoreceptors and baroreceptors and proprioceptors throughout our bodies, and they really love getting stimulated in relation to the force of gravity every day in many more ways than many people stimulate them because we just sit at a desk, for example, or have a much more sedentary existence. But, movement can really enhance the microbiome too in this regard. It may seem counterintuitive, like what does the microbiome care? The microbiome likes movement is what I'm saying. So it all plays into it. It really does. And so again, the body is truly an ecosystem and we can participate in our own well-being.
Right. So did you want to speak a little more on how breastfeeding can impact the gut microbiome of an infant and, for example, how long is ideal? Is there any research that talks on that?
Yeah, there is actually. I did a blog post called Don't Let Your Baby's Microbiome Grow Up Too Fast back in May of this year because, so there are these HMOs. They stand for human milk oligosaccharides, and oligosaccharides are actually a kind of sugar, but this is where different types of sugar play in. So not all sugar is created equal. So the sugar that, we talk about when we say sugar usually means like fructose and glucose and sucrose and those kind of things. So there are other sugars that are more indigestible, meaning they don't have calories, they don't necessarily even taste that so to us. So anyway, in breast milk, there are these HMOs, human milk oligosaccharides, and what they're there to do is feed the baby's microbiome. So not only does the breast milk have its own microbiome to share, where it has its own various types of bacteria, but it has these HMOs to feed the gut microbiome. And so breast milk influences the development of the gut microbiome in a favorable way. And so it really happens mostly, during the first year of life, especially because, the child isn't even really eating food in the beginning. And I just wanted to put it in pitch form. Do not food too early. This push to introduce food, especially things like rice, too early can really alter the gut microbiome. And it's important. So the gut microbiome of children who are no longer breastfed, it changes, and there are more adult-type species. So it's almost like the baby or the child is missing these developmental stages, like bifidobacterium or bifidus is a very, very important flora that needs to be present in high amounts in the gut. And people often don't have very much or any of it at all, and this is a time during breastfeeding to establish it. So things like Clostridium difficile, I wanted to talk a little bit about it because it's very prevalent right now as an infectious disease issue that people in America and around the world. But C. diff, what it is it's a superbug that comes if somebody takes antibiotics, for example, and it could just be antibiotic eye drops, it could just be antibiotic ointment on your skin. It doesn't really have to be, pills that you swallow to have this happen. It can kill off the normal flora in the body and allow the C. diff to kind of take over as a superbug, and it's very, very deadly and dangerous. And it's a problem. It's skyrocketing in the last 20 years in America, Canada, other places, to the point where it's a serious, serious issue. And so the problem being that as soon as a child is no longer breastfed, their gut flora already is going to have an accelerated growth of Clostridium and other abnormal species. And so the gut development is becoming mature at a much earlier age, which could be a setup for more infectious disease and antibiotic not really working, for example, later in life. So with the mortality from C. diff rising and with antibiotic use being such a big problem in livestock, et cetera, so here's yet another factor that we can throw in is that early cessation of breastfeeding or not breastfeeding actually human microbiome for various diseases, including infectious disease, and that's actually a big problem. And so not only are the antibiotics less effective, but they're more likely to cause these horrible side effects of superbugs.
Wow, that is scary just to hear about that. And another thing I've heard of recently is, SIBO, small intestine bacterial overgrowth. That's something that I don't think was really talked about, 20 years ago, and now it seems to becoming more rampant, and that's all related to what you're mentioning. There's this imbalance in the microbiome that allows for overgrowth of this bad bacteria and candida, parasites, other things that are not supposed to, they're all part of our body, but they're not supposed to be in an overgrowth state. And when they do, it causes serious illness, serious symptoms.
Yeah. It is definitely something that we have to start looking at. And I think part of the problem is that people became very entrenched in their perspectives because it all looked like it all fit together so brilliantly. The germ theory, it's so much more complex. And so I think, again, changing our perspective is probably the first thing that has to happen, just so that we can appreciate the complexity and what really needs to happen to optimize, our survival as a species kind of depends on this.
Right. Well, would you like to just leave our moms with any last thoughts regarding this topic?
Sure. Well, I would say that vaginal birth and breastfeeding are the way to go, but I also understand that sometimes that isn't possible, and I always want to tell people, don't feel guilty if you can't make the best choice. Always try to make the best choices you can whenever you're faced with a decision, and move forward with your best intentions. And what I would say is, look at the work of Weston Price, the dentist who did a lot of research about diet and fetal development. Look at, ways to support your own microbiome from, for food and fermented food perspectives, as well as different probiotics, because the research really does support that these things are beneficial to your babies and, their development and even, their medical history and future risk of disease for their entire life. And, breast really is best. And so really, make that effort to optimize the chances of breastfeeding working out. I know that there are a lot of challenges in our culture, and the movie Breast Milk is one that I really like that kind of illuminates that. But, moving in the right direction is I think the best that we can all do, and that it really is very important.
Well said. Dr. Eden Fromberg, thank you so much for coming on the show again today.
Thank you so much for having me. It's always a pleasure speaking with you.